is Preeti and you're watching my resolution. In this video, we'll be learning about the drugs used for in the gouts that are what are like a trick you can remember. I don't explain you in this video. I'll be explaining about all about gout in my next video. Here you will be knowing how to remember the drugs used in a gout. That is, there are two types of gout. Acute, which occurs in a short duration, acute gout, and chronic gout. In acute gout, there are three drugs. Chronic gout. In acute gout, there are three drugs, that is 1, 2, and 3. The first drug will be NSAIDs. The first drug, NSAIDs, non-steroidal anti-inflammatory drugs, and colchicine, which inhibit the cell division, which arrest the cell division, and then glucocorticoids. These names are not so difficult, so you can remember, I guess. NSAIDs, colchicine, and glucocorticoids. For this, I will be saying the trick. Again, chronic gout. For chronic gout, there are two types of drug which inhibit the synthesis itself. That are synthetic inhibitor. Synthetic inhibitors. Example: allopurinol, which you might also studied in biochemistry. Allopurinol. And other drug, how you will remember, means February, Feb, ox, no, cow or like ox, it will be similar to cow. Ox you write as ulta, ox, ox. So stat, this is the other drug, febuxostat. And other drugs which are used in a chronic gout are uricosuric. Already uric acid is formed, and these helps in uricosuric drugs, which helps in excretion of uric acid in the urine. For this, you can remember as Benton. In your childhood, you might have seen the Benton cartoon, so you can remember he is a pro in like killing people by using acid. This is a code. So is pro, ben. Instead of acid, ACID. He is not that rich, so he will be using ECID. Probenecid, and sulfur in pyra means like fever, pyra zone. Fever means rise in temperature, high temperature zone. So sulf in pyra zone. And other drug will be, you got less marks in Urdu, so less in Urdu. This is all about the drugs used for the gout, like acute gout and chronic gout. Acute gout we use NSAIDs, colchicine, and glucocorticoids, whereas in case of chronic gouts there are two types of drugs, that is synthesis of uric acid itself is inhibited by allopurinol and febuxostat, and whereas the uric acid is excreted through the urine by these drugs. The example for this is a probenecid, sulfenpyrazone, and lesinuride. These are the drugs which you need to remember for the gout. If you write this flowchart also, you'll get marks. Thank you.